The second segment of the Nightly News is brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.
Thanks for staying with the broadcast. St. Lucia's Prime Minister Philip J. Pierre has made his first appearance internationally, and with it has called for unity as the regional bloc tackles misinformation surrounding COVID-19. Pierre was in attendance at the 6th Summit of Heads of States and Governments of the Community of Latin America and Caribbean States, CELAC, which was held on Saturday in Mexico City.
Mr. President, St. Lucia is a small country of only 238 square miles, but our people share the same hopes and aspirations of people all over the world who care for a better quality of life, and we respect the doctrine of true democracy and non-interference in the internal affairs of other countries. Mr. President, in spite of our size, we share the same problems. Unemployment among our people, especially the youth and women. The threat of climate change that can and has nearly wiped out our entire countries. The failure of the international financial community to recognize our vulnerability and halt the classification of our economies as middle-income countries, particularly now with the crisis of COVID. The unequal financial and trade restrictions placed on our small economies. In this regard, we note the ascension of Costa Rica to the OECD and trust that our issues will be raised in that important body. Mr. President, we believe that ECLAC can serve as an important voice for unity and cooperation in our region. We look forward to the discussions and deliberations on self-sufficiency in health matters, particularly at a time when our countries are plagued by the COVID pandemic. And let me take the opportunity to thank the government and people of Cuba for their support in our fight in the COVID pandemic in St. Lucia.
And that was Prime Minister Philip J. Pierre at the CELAC Summit held this past Saturday. Member of the Grand Riviere Minibus Association, Lincoln Casimir, is expressing his dissatisfaction with the National Council on Public Transportation's representation of minibus operators, saying that the council does not have the best interests of drivers at heart. Casimir says that the various minibus associations throughout the island should form their own council to represent them at the national level.
Member of the Grand Riviere Minibus Association, Lincoln Casimir, is calling out the National Council on Public Transport, NCOPT. Casimir is expressing displeasure with the actions taken by the council and also the level of representation minibus operators have been privy to over the years. He says that at this point, the NCOPT is not working towards the benefit of drivers, but rather furthering their own agenda.
I'm not satisfied with the way National Council have been representing us as bus drivers, bus owners. They're just not doing it right. And I see them as a bunch of dishonest people, and they are not for us. Because at the end of the day, all they want to do is go to government and settle for rebate. And the reason why they only after rebate, because at the end of the day, they take 5% off each driver, which that is not fair, because we are paying National Council to represent us. So why, if government give a rebate, they want to collect 5% and saying that's consolation fee, which that's already dishonest. That's why I'm calling them dishonest. Because at the end of the day, if we are paying National Council to represent us, sometimes years National Council hasn't done nothing to represent us, and they attend one meeting for government, why should they take 5% of each drivers?
Casimir further expresses his dissatisfaction with the NCOPT, saying that when Grand Riviere minibus operators required support from the council, it was not given, and they felt as though the NCOPT was working against them.
Since last year, Grand Riviere, we have a form of no confidence. There was drivers that was in doubt and signing it, but after National Council went to the media, where they're supposed to be our lawyer, they're supposed to be our protector, they went to the media and lambasted us and asked government to lambaste us and police to arrest us. So they totally proven it that they are not for us.
He says that the minibus associations around the island should formulate their own local councils to represent them at the national level, as the NCOPT is not doing what needs to be done.
Somebody has to come out and speak. and they will say to the president, oh, government doesn't want to see no association if they not under the National Council umbrella. So as I'm saying to other associations, the same way we planning to tag with Grozile, Monshi, Babono, make enough thing I ask for, I want the South, the East, the West to do the same. All of them come together and do the South, the North. So when we have to meet with the government, we send a president from each, and therefore we'll be on the right track. We will see better light in our business as minibus drivers.
Casimir says that the NCOPT should be more involved with the minibus operators, and their top priority should be to promote the interest of minibus operators. Reporting for the Hot 7 Nightly News, I am Kareem Nelson.
The Caribbean Public Health Agency, CARPHA, is bolstering health and safety in the tourism sector in the region, including in St. Lucia. This as countries within the region continue to battle the COVID-19 pandemic. A tourism health program is being rolled out by CARPHA, and St. Lucia is first on the list. Donald Nvite is the permanent secretary within the Ministry of Tourism.
The Caribbean Public Health Agency, CARPHA, has been working alongside the tourism industry for quite some time, actually a couple of years, even pre-pandemic. And CARPHA has been collecting and doing regional surveillance within the region for a lot of the public health issues that even emanate from the tourism sector. One of the core areas being the cruise sector. But since the pandemic, CARPHA has been zooming on how it can assist the region, all CARICOM member states, in providing surveillance and providing technical assistance in driving awareness of COVID-19 and how we can open the tourism industry safely. As part of that, there is a tourism health stamp, a tourism health program that CARPHA had embarked on pre-pandemic that we find very impetus for us to really push at this time, because it's an avenue that could help increase awareness of COVID-19, what to look for, what environmental conditions to survey, what measures and protocols can be put in place to mitigate against spread.
Officials from CARPHA and the OECS Commission are set to engage local tourism officials this week to help strengthen St. Lucia's capacity to respond to public health threats, improve the health and safety standards, and enhance tourism resilience policy in the hospitality sector.
The objective of CARPHA coming in country is really to drive home the message of how we can conduct tourism activities in a safe way and how we could use the tourism health stamp to drive the awareness and surveillance within the tourism industry. As part of that, there's also a web-based application that had been enacted so that CARPHA can also get surveillance and monitoring illnesses and sicknesses as they develop in a form that visitors and service providers can go on the platform and report illnesses as they occur. That data is transmitted directly to CARPHA in a very ready form so that they can monitor across the region.
It is anticipated that the consultations will engender a greater level of understanding on the importance and benefits of the tourism health program. Community activist Aaron Alexander has taken issue with some of the statements made by regional leaders concerning the COVID-19 pandemic. Alexander said that some of the proclamations made could prove to be harmful. He's questioning the strategies employed by regional governments and also asked why ivermectin is not being utilized as a remedy to combat COVID-19.
The COVID-19 pandemic has undoubtedly sparked controversial conversations. From pro-vaccine people to those who are anti-vax, the debate surrounding potential mandatory vaccinations and provisions implemented by governments to alleviate the woes of COVID-19 continues. Recently, Antigua's Prime Minister Gaston Brown stated that after September 30 of 2021, vaccination will be made mandatory for visitors to the island and eligible sectors of the country. Other regional leaders have also taken firm stances regarding the COVID-19 pandemic. Grenada's Health Minister Nicholas Steele announced that an ethics committee will be implemented to determine who lives and dies. Community activist Aaron Alexander says that he is bewildered by some of the proclamations made by regional leaders. He says that these actions taken will result in negative repercussions.
I say to the Prime Minister of Antigua, Gaston Brown, you will create a situation of employees in all sectors withholding their labor in massive numbers, and that will cripple your government. Also, civil unrest, and if such a policy is carried out by supermarkets, there will be hunger and starvation in your country, and massive boycotts of businesses who adopts that same policy. To Grenada and St. Vincent, I ask the following questions. Have you all explored and used all the tools in the toolbox to fight COVID-19, including the use of vitamins D, vitamin C, and even zinc to help your people's immune system to be more robust should they get infected? 2, do you all know that countries have used those tools and they are being used currently and they have seen a 50% reduction in hospitalization and even deaths? 3, do you all have to wait for the WHO to give the okay before you all decide to do this to save your people?
Alexander further questions regional leaders about why the viability of alternative means such as ivermectin are not being explored to combat the COVID-19 virus.
Do you all know that currently Mexico, El Salvador, and India are using ivermectin as a preventative measure, and it is working, and there is science to support these things?
Alexander is calling on CARICOM to assist the facilitation of the approval of the Cuban vaccine, since many people have expressed comfort with taking the Cuban vaccine if it was made available.
The Caribbean people are vaccine hesitant. Yes, it's true. However, a vast majority are expressing that they would feel more comfortable taking the Cuban vaccine. Therefore, I asked Mr. Gaston Brown, as chairman of CARICOM, what has he done by way of appealing to the WHO to speed up the approval process for the Cuban vaccine so that it can be made available to the people of the Caribbean? Because we don't trust the other vaccines. It is quite clear there is a deep-seated distrust in the vaccines through the legacy of slavery, through the legacy of medical tyranny that have been used and experimentation on our people. There is a deep level of distrust in those vaccines currently.
He commends Prime Minister Philip J. Pierre and Health Minister Moses Jean-Baptiste for not following the lead of regional leaders and remaining steadfast in not making the vaccine mandatory. Reporting for the Hot 7 Nightly News, I am Karim Nelson.
While many parts of the world are reporting a steady or decreasing number of COVID-19 infections over the last week, the Americas reported a nearly 20% increase in new cases. That's according to PAHO's director, Dr. Carissa Etienne, as she addressed PAHO's weekly press briefing last week. 1.4 million cases and 23,300 COVID-19 related deaths were registered in our region.
In North America, infections have risen by a third due to surges in the United States and Canada. In the Canadian province of Alberta, COVID cases have doubled over the last week, and hospitals are experiencing a critical staff shortage. The US is reporting more than 100,000 new daily infections for the first time since January, and hospital capacity in many southern US states remains worryingly low. Infections are also surging in Costa Rica, Guatemala, and Belize, as many hospitals are completely saturated with COVID patients. Meanwhile, infections have slowed in the Caribbean, although there are a few notable exceptions. Grenada, Barbados, and Bermuda are reporting sharp jumps in cases, and Jamaica saw its highest weekly case count since the beginning of the pandemic.
PAHO, however, is encouraged that more than 30% of people in Latin America and the Caribbean are fully vaccinated against COVID-19. But because these doses have not been equally distributed, there is still much to do to reach those who need it. Dr. Etienne highlighted the pandemic's effects on children and adolescents and their education.
Our kids have missed more school days than children in any other region. And despite efforts to leverage virtual classrooms, these can never substitute in-person schooling, because schools are not only places where children get an education, they are also places where children socialize and can receive mental health support or a nutritious meal. Each day that children go without in-person schooling, the higher the likelihood that they drop out and never return to school. For some of the most vulnerable children, particularly for our girls, this can have lasting consequences.
While COVID-19 vaccines are not yet approved for children in most countries, practicing physical distancing, washing hands often, wearing masks in public, and avoiding crowded places can help keep children safe. And this is the Hot 7 TV Nightly News. There's more after the break.
The second segment of the Nightly News was brought to you by Labrie Credit Union. Labrie Credit Union. We are not a bank. We are better.